Good day, everyone. I'm Giancarlo Villabanes. I'm a reporter about brain and spinal cord tumor overview. So, first of all, I want to greet everyone good day and happy nice day, especially to our clinical instructor, Mr. Marsha and Messias. So let's begin my presentation. So my outline presentation is all about brief anatomy and physiology, definition and etiology, pathophysiology, signs, symptoms, diagnostic tests, medical management, and nursing management. So, anatomy and physiology, the brain controls many important body functions such as emotions, vision, thought, speech, and movement. So, ang brain po, ito po yung soft sponge of mass of nerve cells and supportive cells or supportive tissue pala. So, itong supportive tissue, so, di ba? So, ang brain is meron siyang major three parts, which is the cerebrum, cerebellum, and brainstem. So, the spinal cord connects the brain to nerves in most parts of the body. This allows the brain to send messages throughout the body. The network of the brain and spinal cord, the central nervous system. So, yun, tinatawag ang brain and spinal cord sa part siya sa central nervous system. So, itong spinal cord po, ito po yung made up of bundle of nerve fibers. So, ito po yung nag-runs down from the brain through a canal in the center of the bones and the spinal. This bone, ito din po yung nagpro-protect sa spinal cord. So, just like brain. So, the spinal cord is covered by the meningitis and cushioned by the cerebrospinal fluid. So, next is definition and etiology. So, tumors of the brain and spinal cord are abnormal growths of tissues found inside the skull or the bony spinal column. The brain and spinal cord are the primary components of the central nervous system. Benign tumor are non-cancerous. So, another details about benign tumor, ito po yung it can form anywhere. So, and also, itong benign tumor is nagka-classified siya where they grow, like lipomas. So, ang lipomas, nag-grow po siya from fat cells, while the myomas, nag-grow siya from the muscle. So, mayroon po mga types ang benign tumor that I cannot discuss the definition, but I say it what the types is. So the type is adenomas, lipomas, myomas, and nevi. So nevi is also known most. So next is the malignant tumors. So sinasabi sa so just like said of the presentation is are cancerous. So, ang malignant tumor, ito po yung cells that grow uncontrollability. So, it means hindi siya nakokontrol. And also, nag-i-spread siya locally and to distance of sight. For example, nag-i-spread siya sa bloodstream or the lymphatic system. So, itong tinatawag na nag-i-spread is also metastasis. So, itong metastasis, nag-occur po siya anywhere in the body. Ito yung most commonly nakikita sa liver, brain, and bone. So, next is, may mga, in rare cases, children have inherited genes that increase the risk of a brain or spinal cord tumor. So, this include yung neurofibromatosis, Li-Fraumeni syndrome, Lynch syndrome, and tuberous sclerosis. So, as you can see in the image 1, ito yung picture regards sa fibromatosis. So little did I know, ang neurofibromatosis, ito po yung group of genetic disorder that nagko-cause through the tumor. So nagko-form ito from the nerve tissue. So itong tumor na to, nagde-develop siya kahit saan, where basta nakalocated siya sa nervous system. So next is the image 2 is Lee-Fraumeni syndrome. So as you can see, yung girl, I didn't know kung girl or boy siya. So as you can see, so no hair siya, diba? So itong Lee-Fraumeni syndrome, ito po yung nag-i-inherited siya from familial predisposition to a wide range of nag-range siya sa center of 10 rare cancers. So, and also ito po yung nag-due to a change like mutation na tinatawag. So, mayroon siyang also known as, ito din po yung also known as TP53, which is itong TP53, ito po yung superior gene na nagkakos dun sa Lee-Fraumeni syndrome. Okay, so next is the Lunch syndrome. So since I have no picture about this, I just want to give information about the Lynch syndrome. So itong Lynch syndrome po, ito yung also known as hereditary or napapasa siya. Hereditary non-polar-posis colorectal cancer. Okay? So it means hereditary, ito yung napapasa, ang Lynch syndrome. And also, ito po yung most common cause ng hereditary colorectal colon cancer. So colon siya nagde-detect. Next, and also this kapag yung people po, or if one person is having a Lynch syndrome, ito yung are more likely get colorected from the cancer, and to the younger age, before 50, including uterine, stomach, liver, kidney, brain, and certain type of the skin cancer. So next is tuberous sclerosis. So ano nga ba tong tuberous sclerosis? So as you can see, that yung child sa picture is meron siyang parang pimples, pero hindi yan pimples. So I give an idea about the tuberous sclerosis. So itong tuberous sclerosis na to, ito yung conditions that causes the growth of the non-cancerous or benign. So ito po yung part siya ng benign tumor, ang tuberous sclerosis. So ito po yung nangyayari sa cells grow out of control and divided more than they should. So it means nangyayari ito sa mga cells growth while controlling from the divide or more than pa. Okay? So next is the pathophysiology. So pathophysiology is due to oncological condition. True, tumor compresses the brain tissues. So I cannot explain this. Another is causes neurological deficit, headache, and seizures. So as you can see, ang tumor talaga is nagkakause talaga ng deficit or headache. Then edema or tumor formation. And the lastly is increases intracranial pressure. So sa mga child is common to kasi ang tumor is talaga namang nakaka-pressure through intracranial. So dapat talaga is maging maingat tayo sa mga gantong cases, especially sa child. Next is the sign and symptoms. So, ano nga ba yung mga sign and symptoms ng brain tumors? So, hindi mawawala syempre ang headache, common na yan. Next is seizures. personality changes. So, bakit nagkakameron ng personality changes? Siyempre, um, sa brain tumors, di ba, meron siyang ano, siyempre, as you can see, um, yung isang bata, for example, yung isang bata is, um, masakit yung ulo niya. So, as you can see, nag-iiba-iba yung mood niya. So, siyempre, nag-iiba din yung personality changes niya. So, weaknesses in the arm and legs. So, common na din siya, numbness o yung namamanas. Yung kanyang mga kamay, ganun, or toe. Next is spinal cord tumor. So, as you can see, ang pinaka-center talaga niyan is back pain sa likod ng bata. And also, since yung spinal cord is nakakonect siya sa malapit siya sa ating urinary, syempre, magkakaroon siya ng weaknesses o panghihina or paralysis on both sides of the body. And also, loss of bladder or bowel control o hindi napipigilan ang pag-iihi. Yun, ito yung nagkakos sa spinal cord tumor. Next is diagnostic test. So, ito po yung mga test na kailangan dapat igawa o isagawa ng isang nurse or doctors na mayroong tumor yung mga bata. So, the one is blood test. So, germ cells tumors may secrete chemical into the blood that can be detected in the laboratory. So, moreover, ang blood test po, ito po yung germ cell tumor is suspected. Ito yung sinususpect natin kung yung kanyang tumor is meron bang defected. So, ang nag-test nito is specialist. So, itong specialist is nag-take siya sample ng child blood to check for a tumor marker or a substance in the blood that indicates the presence of the malignant tumor in the body. Next is neurological exam. So, the doctor checks your child balance, coordination, reflexes, and senses of smell, hearing, touch, and vision. So, importante ito na itest sa isang bata kasi ang neurological exam, ito po yung it depends of the child age. Tandaan, hindi po ito po ay nakadepende sa child age o yung edad ng isang bata. So, the doctor ang maaring mag-evaluate dito through memory and mental status and then checking the behavior, attentiveness, and thought processes. So, next is imaging test. So, ito yung give your child doctor a detailed look at brain and spinal cord. So, dito sa imaging test na to, ito po yung image na nagpo-provide sa pediatric or yung sa child neurosurgeons and radiation oncologists information about the size. So, kailangan po din malaman. So, dito din po sa image test is nalalaman din dito yung location ng tumor kung saan siyang parte nakalugar yung tumor. Next is MRI scans. So, an MRI scans uses magnetic field and radio waves to create computerized three-dimensional images of the brain and spinal cord. So, ang MRI scan po, ito po yung kailangan dapat yung child is nakahiga on the table. On that, so dapat, so diba ang child kailangan nakahiga sa table that is slide into tunnel shape machine. So, as long as ginagamitan din ang MRI scans sa sedation or anesthesia. So, para makatulong po ito sa young children na mag-stay during this test because there's no radiation exposure. So, itong test na to, itong MRI scan na to, tinitest siya 30 to 45 minutes. So, yun. So, as you can see the picture, di ba? Ayan. Ayan yung MRI scans. As you can see here. Oh, ayan. Ito yung MRI scans natin. So, next, letter E is the CT scans. So, occasionally, your doctor may order a CT scan which uses X-ray and computer to create three-dimensional cross-sectional images of the brain and spinal cord. So, ang CT scan, yung doctor is nag-i-inject siya through material into the vein. And also, it travels throughout the body for para malinawan or allowing to clear sa mga view organs and blood vessels. And also, itong CT scan is para ma-contrast yung fluid contains in iodine, and so it's not, but itong CT scan is hindi siya recommended for anyone with an allergy to seafood or iodine or an iodine. So ang CT scan din is kailangan din maggamit ng apron para ma-avoid yung radiation exposure. And also, kapag naman pregnant yung mother, is kailangan natin i-advise na maghintay sa labas ng room during the test. Kasi ang test na to, itong CT scan na to, is few minutes lang siya tatapos. So, next is magnetic resonance spectroscopy scans. So, itong a magnetic resonance spectroscopy may be performed along with MRI to identify the molecular makeup of the tumor, which can indicate its type of aggressiveness. So, itong magnetic resonance na to, ito po yung tinitake lamang 10 to 15 minutes to the MRI test. Okay? So, take note, 10 to 15 minutes ang pag-test nito. Next is functional magnetic resonance imaging scans. So, a functional MRI shows the brain in the action. Images of the brain are taken while the child performs a simple task such as moving his or her hand. So dito, ito po yung test na minsan ay ginagawa before surgery or radiation therapy. Because para malaman o ma-determine natin kung yung tumor is affecting to a person's movement and also sa speech, so that itong therapy, it doesn't affect the areas of the brain. And also, responsible ito sa mga task. Moreover, painless electrodes are placed on the head during MRI. So, kailangan po natin i-position yung child on the head during MRI. So, next is stratography. Okay. So, this new MRI technique allows doctor to trace tracks in the brain, the nerve fiber pathways that make up the brain's white matter. So, itong tractography, because brain tumors can displace or infiltrate, so itong these areas, it's important that prior to surgery, neurosurgeons map the pathways that control movement, like vision or language. So, itong map na to, itong tractography na to, is nakakatulong siya para maiwasan ang damaging sa nerve fibers during surgery. So, next is biopsy. During an open biopsy, a pediatric neurosurgeon removes a small piece of the tumor, which is analyzed to determine what type of tumor it is, where it is, and whether it's benign or malignant. So in children, this procedure is usually performed at the same time as surgery to remove the tumor. So itong biopsy, ito po yung um, for tumors na hindi nare-remove, or when surgery is not the primary treatment, needs a so kapag hindi yung surgery ay hindi siya treatment sa biopsy, so kinakailangan is mayroon tayong esterostastic biopsy, CT scan or MRI scan, kasi ito po yung para mag-guide a needle of the tumor through a small hole made in the skull. So as you can see in the picture, so may hole po dyan, isabihin may butas yung brain ng bata. So yun po ang ating biopsy. Next is lumbar puncture. So your child's doctor inserts a small needle into the lower back to withdraw spinal fluid for laboratory testing. So ang lumbar puncture, ito yung also called spinal tap. Why? Kasi ito po yung test na piniperform under general anesthesia in children. And also, use ito para ma-determine whether cancer cells have spread beyond the brain. Next is molecular profiling studies. So, it involves tests to identify the cancer, genetic makeup, and determine what is driving the tumor's growth. So, itong last na molecular profiling studies, ito po'y inaalaw ng doktor para mag-gather yung information about the cancer, including its likelihood of responding to certain treatments. So, next is medical management. So, surgery. So, the most common type of surgery to remove a brain tumor in a child is called craniotomy. So, ano po ba itong craniotomy? So, ang craniotomy, ito yung procedure na mayroong ginagamitang incision in the scalp, which is, ito yung nagre-removing through the piece of bone from the skull. Okay? Next is the what to expect after surgery. So, common na to, maaring mayroong epekto ito kapag tapos ma-surgery ang isang bata or ang pediatric. So, after the operation, to remove the tumor, the child may have a tube called drain coming out of the incision that allows excess cerebrospinal fluid or CSF to drain from the skull. So, other tubes may be placed ito to allow blood that builds up after surgery para po ma-drain ito from under the scalp. So, ang drains are usually re-remove siya after few days. So, an imaging test such as MRI, like diniscuss ko nung past PowerPoint, or CT scan, ito yung typically nagadan in 1 to 3 days after the operation para makonfirma natin kung gaano siya kung how much yung tumor niya na na-remove. So para ma-recovery ito, ang time in the hospital is usual in 4 to 6 days. But it depends ito sa sizes tsaka location ng isang tumor, and whether other treatments are given na mga gamit ito. for recovery time. So next is surgery to help the CSF flow blockage. So if a tumor blocks the flow of CSF within the head, it can cause increase intracranial pressure (ICP) inside the skull. So ito inside the skull, it means ito yung intracranial pressure or tinatawag na ICP. Kasi ito is nagkukos ito ng symptoms like headache, nausea, and drowsiness. And also may even be life threatening. So itong surgery is to remove the tumor, can often help with this, but there are also other ways to drain away excess in CSF and lower the pressure if needed. So placing a shunt. So neurosurgeon may put in a silicone tube called a shunt, sometimes referred to as a ventriculoperitoneal or VIP shunt. One end of the shunt is replaced in the ventricle of the brain, an area filled with CSF, and other end is placed in the abdomen or less often the heart, and would then be referred to as ventricular shunt. So, ang placing shunt po kasi ito po yung tube na nag-runs under the skin of the neck tsaka chest. Kasi ito yung nag-a-allows na ma-access yung CSF to flow into the abdomen or heart, where mixes with other fluids. The flow of CSF is controlled ito sa value sa value ng isang tubing. Okay? So next is making an opening in the third ventricle. So another option to treat increased pressure in the skull in some cases is an endoscopic third ventriculostomy. So ang maaari lang po nito mag-open the surgeon. Surgeon lang po ang maaaring mag-open nito ng floor in the third ventricle at the base of the brain para ma-allow yung CSF na mag-flow again. And this operation na to, ito yung tapos na sa operation through the small hole in the front of the skull. So ang advantage po nito is ma-approach niya na hindi kinakailangan i-require ng shunt, but there is a chance na magkamerong opening po made in the ventricle. Alright, close up again. Maari po siyang ma-open in case na ito ay hindi ma-operahan ng maayos. So next is placing external drain. So if the pressure inside the head needs to relieve for a short time, an external ventricular drain (EVD) might be put in the place to allow the excess CSF to drain out of the body. So ito pong placing in the external drain, ito po yung small tube kasi ito yung one end na kinukuha into the ventricle, and also in the other end is attached ito sa collection bag outside the body. So along with collecting po, the excess of CSF will drain can also be used to measure the pressure inside the skull, as well as para makita kung yung tumor cells, blood, or sign of inspection in the CSF. So next is the surgery to to place ventricular access catheter. Surgery may also be used to insert a ventricular access catheter to to help deliver chemotherapy directly into the CSF later on. So ito pong ito po kasi yung type na tinatawag na Omania reservoir. So ano po ba ito? Sa pagkakaalam ko, ito po yung small incision na nangyayari sa scalp o made in the scalp, and a small hole is drilled in the scalp. And also, ito yung flexible tube na ini-inserted through the hole until open end of the tube. And also, this tube is in a ventricle where it reaches in the CSF. So next is the possible risk and side effects of surgery. So surgery on brain and spinal cord is serious operation, and surgeons are very careful to try limit any problems either during or after surgery. So narito po yung mga complications during or after surgery. So first, bleeding. So common na ito dahil talaga naman mag-bleed talaga kapag sinusurgery natin ng isang body ng child o yung tumor. Pagbubuksan natin yung brain. Next, infection. So, maaari nito maging komplikasyon kasi nga, since tumor siya, so kapag nagka-infect siya, mas lalong nalala yung tumor na nasa bata. Then, seizures or reaction anesthesia are rare. So, ito yung kadalasan na hindi natin hindi kadalasan ito na nalabas na komplikasyon, pero nalabas siya, bihira lang. But they can happen, ito nangyayari nga. So last is the nursing management. So ang nursing management po natin is magkahiwalay, which is the brain tumor and the spinal tumor. So ano nga ba tong mga nursing management natin regarding sa brain tumor? So first is post-operative neural assessment. So ito lang yung basal signs, LOC, strength, equality of grips, head circumference, assist of anterior fontanelle in infants, providing support for parents or caregivers. Syempre kailangan natin i-provide yun support ng parents sa mga bata kasi syempre as a child kailangan ng magulang para mas lumakas yung loob nila kapag nandyan yung magulang na sumusupport, diba? So frequent monitoring for post-OP, increase intracranial pressure, monitor fluid and electrolytes. So as our tackle in may subject in fluid and electrolytes, sabi ni Sir Fusio sa amin na kailangan dapat is i-monitor natin yung fluid electrolytes kasi maaari itong magkomplikasyon sa body ng isang bata or ng isang adult. So administer medication such as steroids. So kailangan natin ng mga administer medication like steroids. So ito yung minsan na ginagamit na kadalasan sa brain tumor kapag may merong defect o yung merong tumor na merong tumor yung bata. So next is the spinal cord tumor. So providing of pre-operative care. So recognition of neurologic changes through ongoing assessment, pain control and management of altered activities of daily living due to sensory and motor deficits and bowel and bladder. So ayan. So since ang spinal cord natin is malapit siya sa ating bladder, so maaari talagang maapektuhan. So kailangan natin ng ongoing assessment through this. Okay? Next is nurse assess for weaknesses, muscle wasting, spasticity, sensory changes, bowel and bladder dysfunction, and potential respiratory problems, especially if a cervical tumor is present. So ito lang yung dapat gawin kapag may yung yung child is merong siyang cervical tumor na meron siya ng changes like bowel and bladder and then nakakaroon na siya ng muscle wasting, ganun. Then the patient is also evaluated for coagulation deficiency. So kailangan natin dapat yung patient na ma-evaluate natin. Next is breathing exercise are taught and demonstrated preoperatively. So kailangan natin yung patient natin as a nurse, kailangan natin is may exercise natin o to i-teach natin kung paano ba yung proper breathing para ma-relax yung lungs, and also yung lungs is, since the lungs is malapit siya sa spinal cord, so kailangan siya ng proper breathing para mas maayos or mas 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 kumbaga is um, mas mabawasan pa yung sakit na nararamdaman ng isang pediatric. So, yun lamang po ang aking report. So, thank you for listening and hope you learn a lot. So, my topic again is brain and spinal cord tumor overview childhood. So, thank you so much and God bless.